saying that the session is going to. Excellent. Always just anticipating the Zoom voice. So we're thrilled that you're able to join us this evening or this morning from wherever you might be for the first of the U21 Health Sciences staff seminars that are being hosted by the Interprofessional Education Working Group. We have two esteemed colleagues that are joining us from McMaster in Hamilton, Canada, and we will introduce them shortly. First, I wanted to share, my name is Sarah Wachowski, and I am from McMaster also. I'll be the moderator for this afternoon or this evening or this morning, depending on where you're joining us from. And I would just like to do a few housekeeping things before we get started, and I will introduce the guests after that time. So you're welcome to have your cameras on or off for the entire session. If you would like to submit a question at any point during the conversation, if you look at the Zoom toolbar on the bottom of your screen or the side, you'll see a Q&A feature and you're able to populate questions as we go. The guest presenters and myself will see the questions and we'll do our best to queue them up or answer them during the presentation or in the Q&A session at the end. The closed captions or the captions have also been enabled for this session. And so if you'd like to have those available for your own viewing, you can select that on your Zoom toolbar. I'd also just like to pause before we get started to recognize that we're all joining from different traditional territories, and we encourage you to take a moment to reflect and recognize and acknowledge the lands that you're currently joining us from. Because the two presenters and myself today are located at McMaster University, we did just want to take a moment to recognize that we're currently on the traditional territory shared between the Haudenosaunee Confederacy and the Anishinaabe Nations. And that was acknowledged with our Dish with One Spoon wampum belt. Why that's relevant to tonight's presentation is that the wampum uses the symbol of a dish to represent the territory and the one spoon to represent that the people are to share the resources of the land and take only what they need. Hopefully we'll be able to think about that and reflect on those opportunities as we consider our presentation this evening from our guests. So without further ado, I'd like to introduce and thank Dr. Sargeant and Dr. Arain for joining us this evening or this morning for the presentation. I'll start by introducing Dr. Sargeant, who is the Executive Director for the Canadian Coalition for Green Health Care and a Clinical Assistant Professor of Family Medicine. Dr. Sargeant is a family physician who works in addictions treatment and chronic continuing care. He is the founding medical director of the Shelter Health Network of Hamilton and has been the director of medically complex care at St. Peter's Hospital as part of the Hamilton Health Sciences Corporation. In addition to his clinical work, Dr. Sargeant is the president of Trees for Hamilton and the co-founder of Partnerships for Environmental Action by Clinicians and Communities for Health Facilities, or PEACH, in Ontario, Canada. PEACH is a province-wide initiative which is focused on engaging and encouraging and empowering people in healthcare sector to take climate action at their facilities. So thank you, Dr. Sargeant, for joining us this evening. Dr. Arain is the director of McMaster's Center for Climate Change in the School of Geography and Earth Sciences. Dr. Arain holds a Science of Research Chair in Environmental Sustainability and Climate Change. His research interests include hydrometeorology, hopefully I've said that right, climatology, forest, carbon, water cycles, and eco-hydrological and climate models. He established a multidisciplinary vegetation ecosystem restoration and environmental sustainability research program. This program focuses on forest and agricultural ecosystems in the Great Lakes region to fully understand their functioning, carbon sequestration capabilities, and sensitivity and resilience to climate change, and developing the integrated biogeochemical and hydraulic models used in the Canadian climate models to improve their predictive capabilities. You can tell there's words that are not used to or familiar to a healthcare provider here. Dr. Arain has been involved in interdisciplinary research initiatives to measure nitrogen dioxide and other pollutants and to investigate the effects of air pollution on human health in several urban areas of Canada. He has published more than 200 peer-reviewed journal papers. So I'm sure these introductions have done only a small justice to both Dr. Arain and Dr. Sargeant, and I'd like to turn the presentation over to the two of them now. Thank you and welcome.
Thank you very much, and thanks for the introduction. But you guys can see that how different disciplines are linking, but you will see at the end of the presentation how we link with Dr. Myles and I link despite all these things. So thanks a lot. So I'll start with the first part of the presentation, and then Dr. Myles will take over. So I'll share my screen here. So it looks good. Everyone able to see it?
Perfect.
Okay, thanks a lot. So we'll talk about how the health sector will impact the climate change, and then what actions the health professionals may take. So health impacts of climate change and the actions. That's our title. Just to give some background for the climate change, if you are not familiar with it, that our temperatures are increasing, and they are increasing at a very alarming the rapid rate. So you can look at the slide at the left-hand side on the top, that we have an increasing trend in the temperature. And then there is also a color bar at the bottom. So we have already warmed like 1.1 degrees C temperature since the Industrial Revolution. So it seems like small 1 degree C kind of change, but this is global average temperature. So in temperature terms, this is very, very large warming that we haven't seen in 100,000 years in the past. So it's mostly, this coincides with the carbon dioxide, methane, nitrous oxide. We see the similar trends there, the increasing trends there as well. Our current rate is 421. That's the highest ever that we may have seen. Sometimes there is extreme year like El Nino year or some volcano. So there's a little bit more warming, a little bit less cooling, but our trend is pretty solid, like in one way, a very, very accelerated change that we have. So this record is not just coming from the temperature record. If we look at all other records, historic records, they're all telling us the same story. So we can see land surface temperature, we can see the sea surface temperature, we can look at the sea level rise, we can look at the decline in the sea ice, and the glacier mass depletion. So these data come from many different disciplines. So all disciplines, many different disciplines, all scientists are pointing out towards the same thing, a very rapid accelerated warming and its impacts on hydrologic cycle. So this graph on the right-hand side, that shows us the increase in hydrologic cycle, more intense rainfall, more evaporation. So this is where the impacts come in the end. So if we look at this analysis, this shows us the warming. So that's our observed warming, the bar on the left-hand side. And this mostly comes from the greenhouse gas emissions. So actual warming should be this gray line. So it should be much higher. It should be more like a 1.5. But there is a cooling effect because of the aerosols and the dust and all industrial products that we put in the atmosphere. They're also having some kind of cooling impact. So we go like 1.1. But very clear skies and very clear atmosphere, we may even feel more warmer airs. So this graph on the right-hand side, this shows us the carbon dioxide, the fossil fuel use. So this is an exponential increase in the fossil fuel use as well. And the yellow part at the bottom is more like a forest removal or land use changes, mostly the forest removal there. So, but fossil fuel is much more contribution. So all this CO2 or the greenhouse gases that we are emitting, they go in three major pools. So some, they go like almost 1/3 stays in the atmosphere, 1/3 takes in the ocean, and then some is taken by the land regrowth of the forest that we see in some parts of the world. But the ocean is also taking a significant. But remember, if we increase the ocean temperature, the surface ocean temperature, then the CO2 absorbing capacity may decrease. If we have more forest harvesting, then our sink in the biological sink will decrease and more will stay in the atmosphere. So it's like a very, very fine balance is going on there. So you saw the past slide, they were all like observations that we have seen so far. And where we go forward is in this slide. So the black line is what you have seen so far in the previous. You saw the trends, a very, very rapid trend. They were all observation. When we go to the forward in the future by the end of this century, and we look at where we have been, the future changes can be phenomenal. So that you can see the red line at the top. We are looking like a 4 to 6 degrees C change going forward. Even if you don't go until the end of the century, if you go like a 2050, 2060, still there is a very, very significant change. So the going forward is much more drastic if we don't take any actions. So this gives us the temperature records and different scenarios. So we are following currently the red lines. So current emissions, if we follow this as of today, we are following the red lines. But the IPCC, Intergovernmental Panel on Climate Change, they released these reports and they had the Paris Accord as well. So they are suggesting us to go like 2 degrees C change in the future, or maybe better go 1.5 degrees. So these are the blue lines that we should really be going. But these are other things like a global sea. And then by 2050, we would not have any sea ice in September. So all oceans would be free of sea ice by 2050. So that's like a very, very large change that we are expecting to see. So what is happening is that extreme events are changing. So we have seen those massive storms and massive rainfall events that we haven't seen in the past. So this analysis, the graph on the right-hand side tells us that the events that we were used to see in 100 years, now they are occurring every 40, 45, 50 years. So all our infrastructure, our bridges, design, culverts, they're all designed with past 100-year data. So if you have to upgrade all these this infrastructure, we are talking about trillions of dollars and losses, very, very significant losses, because our all design practices are based on 100-year data record, and we don't have data beyond 100 years. The reliable data are like especially distributed precipitation data beyond 100 years. So it would be a big, big challenge going forward. So this shows us some disasters, so how the disasters are changing. So that's up to 2014, but you can see the trend. They are like same way the temperatures were increasing, hydrologic cycle was increasing. So we see these disasters. So mostly they're climatology, like storms, hydrologic, flooding, drought, and meteorological, again, ice storms and all those kind of phenomena. So the major disasters that are happening in the world now, they are mostly meteorological, climatological, hydrological, like water cycle and atmospheric circulation related. And then you see sometimes the scale is phenomenal, like a significant portions of the countries may be impacted. So these are two pictures from Pakistan, 2010 and 2022, major headline. And this 2022 flooding basically impacted the negotiation, IPCC negotiation. And now there's a more realization at the United Nations, and they created a fund, like a global fund now, there was an agreement that there should be support for this kind of disaster. So that these kind of things we see more happening all over the world. The impact is more in developing countries, but the financial losses sometimes are phenomenal in the developing world as well. Like $100 billion of events now are very common in US. So this is just an example from the South versus Northern Hemisphere versus Southern Hemisphere. The story is same. We have wildfires, we have loss of permafrost, storms, infrastructure damage, heat waves, drought. If we look into Australian report, they point out the same things: heat wave, warm temperatures. So countries may be in the north and the south, but the impacts we see are similar. So this is just an example there. And this is Australia, the fires, fire weather graphs, a very significant phenomena. That's Australia, but also in Canada, there's a lot more increase in wildfires, a big impact. And this is like a comparison, the two that in many other countries, we see this kind of trends as well. So this is an example, but one significant factor is the heat waves. So this graph shows this is that the heat waves are increasing at a very alarming rate. So heat waves have a very severe impact on human health and others. So Dr. Myles will be talking about them in a few minutes. But it shows the trend, like we having many more days now with the flooding and many more days with the heat waves. So this was 2021, the big headlines from North America. We saw this record in Layton, Canada, temperature approaching 50 degrees C. People would not imagine that Canada will see the 50 degrees C temperatures in this area. So very record-breaking events happening. And then this was also from the Vancouver in Canada, the shellfish, very big headline at that time, but you can see the contrast of the headline. So we have this headline, but in the same headline news, there was these headlines that people are flying space rockets and big investment, big initiatives, while the whole humanity and the ecosystems are frying at the earth. So this was a big contrast. So I just put it there. So there was, like in US, there has been a decade of drought and heat waves in Southwest that was going on, but all of a sudden we go into this 2023 spring and winter, you see this big flooding where cities are flooding. So it's like going from one extreme to another extreme all of a sudden. So this is happening all over now. There will be significant countries that will be under water stress going forward. So it will be a very major population would see the drought impact going forward as well. So that's like a very water scarcity would be a very big challenge for global population in coming years. But if you look at the vulnerability of the population and emissions, then the vulnerability is much higher for the countries or the per capita emission where the emissions are low. So it means the poor countries are much more vulnerable with these impacts in terms of the economic losses, population, and all health impacts. So vulnerability, and this starts another kind of questions as well, like how we deal with this inequality of these impacts and marginalization community. And within the countries, there may be significant changes as well. It's not like a high income country don't have vulnerable population. There are significant populations within the developed countries that may be vulnerable as well. So this shows us the most impacts are by the extreme temperature. So that's the black mark here in the center, 16,000 deaths there in 2022 because of the heat waves. So that's the largest, and then the flooding and the storm, and the drought. So they're very significant number that we see there in 2022. And then this is losses. Now the flood losses, billions, storm 131 billion, flooding 44 billion. The economic losses of the hospitalization and other economic impacts of the deaths because of the heat waves, they are not included, they are zero. So if you bring in the health impacts or the costs related to those, the numbers would be very, very high. So it's very large economic impacts happening as well. So there is a Paris Agreement, IPCC agreement is advocating that we should go like 2 degrees C reduction. Preferably, we should go 1.5 degree. Many countries, including Canada, has committed that they will reduce their emissions first phase by certain portions. Some is saying 50%, and some are committing by 2050 they will be achieving net zero emissions. So every country has a different targets, but everyone agrees that we have to reduce our emissions. But if you look at the top graph, these are our emissions. So there's a dip related to the COVID, and then back to again normal. You can see this. So emissions are going right. So there are commitments, but there's more ways to go to achieve the targets now. So if you have to go, right now all our things are red. Like these are commitments, implemented policy will achieve this red. That's not desired. We have to go to the blue, like 2 degree, the blue and green. So that's our target, and they will give us 2 degree and 1.5 degree C. So United Nations is saying there's a faster action needed. Yes, you have committed, but your target should be much earlier. Some countries have said, okay, they'll achieve net zero by 2070. So these targets are very, very, very far away. So there's a action needed to reduce these greenhouse gases, but at least there is now the agreement globally that we have to do something to reduce the greenhouse gas emissions. So that will be the point I would like to stop. I think from here we'll talk about health impacts, and Dr. Myles will be talking about.
Altaf, if you could just go back to the last one.
Yes.
Yeah, I like this slide too. The blue line shows that this is not linear from now until 2050. It's a curved line, and if you look at the blue line, it is a significant drop. It is more than 50% of greenhouse gas emissions globally in the next 7 years, and so that's why we call it a climate crisis, as you know. Yes. So that's when I show that slide, I always make that point. Next slide, please. The next slide is an IPCC slide from a couple of years ago. If you look at the blue highlighted area, it is showing the health impacts of climate change on health and well-being. And what is being intersected there are a few different diseases, infectious diseases, heat, mental health, displacement versus continents, and the number of dots shows how significant these things are. And it's interesting to me, if you look at infectious diseases, Africa is included as high impact, as well as North America, which, you know, surprised me in a way. Obviously, we live in North America, but that would likely be tick diseases, tick-borne diseases, which results in Lyme disease in Canada, which initially was something we only saw in this very small area north of Lake Erie, which is between Canada and the States. So just on our southern border, and now that has spread much further north into other provinces, and also West Nile virus, vector-borne disease of mosquitoes, is spreading. Heat and malnutrition from wildfire. You've got a few continents there: Africa, Asia, North America, and the small islands. Mental health. I wonder about data collection in some of these countries that aren't reporting anything here. Most countries are obviously having mental health issues with climate change, and then displacement, Africa, Asia, and again, North America. We see this in the news all the time on the North American side of immigrants coming from Central America and trying to get north into the States. And just last week in Canada, sadly, a few people drowned trying to get from the States across the St. Lawrence River into Canada. Next slide. This, you may have seen, it's fairly ubiquitous, done by Jonathan Patz, who's a professor in the northern USA. I love this one. So if we go around this one, you can look at it as I'm talking. If we go around this one for like a clock from 12 o'clock going around, I'll just talk about the Canadian, what we see in the Canadian side, and you can think about your own countries and what you're seeing here. So of course we have air pollution like anyone does, and that makes asthma, cardiovascular disease worse. Vector-borne diseases I just mentioned. For us, tick-borne diseases and mosquito-borne diseases would be slightly different in all different areas of the world. Allergies, we have ragweed, which is a August allergy season, August to September. That season for us in Canada is getting longer and more severe. Waterborne diseases, thankfully, we don't see that so much in Canada. It does happen sometimes when we have severe storms that overflow septic systems, for example. Environmental refugees, just mentioned that, coming from the south in our case, trying to get into the States and then often moving further north to Canada. Mental health, again, worldwide, anxiety, despair, climate grief, climate angst, PTSD. Water and food supply, fortunately in Canada, not a huge problem unless there is a massive storm or flood. And then, of course, we do see that. Heat, a problem worldwide, and certainly people with heart failure or geriatric patients are more at risk. And finally, injuries and fatalities. In Canada, that would be tornadoes most commonly. We have the second most tornadoes in the world behind the USA. And of course, we do have hurricanes. We had a massive hurricane. Those are going further north now than they used to. Next slide. So that's kind of all the bad news. Hopefully I can focus on some good news. So this is what a group of us started just 18 months ago. We've come a long way in a short time. We started by thinking, what can we do for our health system in Canada, particularly? We are in Ontario. That has about a third of Canada's population is in Ontario. And we started by imagining what would an ideal green facility look like. There's an H for hospital on the front of this, but clearly this could be a long-term care facility, a library, university. Obviously, these concepts go across different sectors. Next slide. So this is PEACH, PEACH Health Ontario. PEACH is an acronym: Partnerships for Environmental Action by Clinicians and Communities for Health Facilities. Next slide. Within healthcare, of course, those health facilities are typically hospitals, long-term care, and clinics. So CO2 per capita, why is this an important initiative in Canada? We are one of the worst in the world when it comes to CO2 emissions per capita. We have partly an Australian audience here. These numbers have changed. This is from 2017. I know Canada has gotten a little better on this scale. Next slide, but we can do a lot better. And what does this have to do with healthcare? Most of the wealthy nations have a carbon footprint for their healthcare sector, which is approximately 5%, and Canada is no different. There are a couple of studies that have been done. One suggested 4.6%. Another one that I've highlighted suggested 5.1%. And of course, in medicine, we are taught, above all, do no harm. We do a lot of harm. The healthcare industry has a bigger carbon footprint than the airline industry. Next. So what was our approach, this Peach group? What was our approach? Ultimately, you want to have a culture of sustainability, whether you're talking about safety within healthcare or EDI or sustainability. This is still important. We still want to develop a culture, but we also need to take shortcuts because we don't have time. Next. So what we did locally, again, Ontario is a fairly big province of roughly 15 million people. It's quite big geographically. There were some great stories within healthcare in Ontario when we started a couple of years ago. So our goal was to reach out and talk to the climate stars, as I call them, whether they were in the food industry or engineering or transportation, and say, how did you do what you did at your facility, and how can we mobilize that knowledge? And then, of course, we got to know those people, and we try to create impactful projects. Next slide. So here we are back at the Ideal Green Facility. These are the categories we came up with. Other groups, there's a group in Canada, BC Green Care, which has similar categories. The Swedish folks have, I think, 6 or 7 categories. So these are somewhat arbitrary, but we think we've captured most of the things that you want to go after to make your hospital, for example, an ideal green hospital. So I'm going to talk about each of these next. So, of course, like anything, you need to have a strategy if you're going to really move the needle. And I've highlighted a few hospitals here. If you know Canada, 2 of these are hospital systems in Toronto, UHN and Sunnybrook, and CHEO is the Children's Hospital in our capital, Ottawa. They've all done this a different way. They've all are having a fair bit of success. But the point is, you don't all have to have the same strategy. There's different ways of doing this. You do need to have someone most responsible. We knew in Canada that there was going, that accreditation for hospitals was going to start including sustainability in their accreditation language. And that's just happening now. So in anticipation of that, we created this guidebook for healthcare leaders. Next slide. We knew that busy healthcare leaders weren't necessarily sustainability champions. And so we made a very simple infographic we could share with you, which in the center of it has this simple checkbox to check off the most important items. We put a lot of thought into this. We think these are, I think there's 22 here, 20 or so of the highest impact initiatives you can take at a hospital to decrease your carbon footprint. So this is really all about mitigating GHGs or greenhouse gases. And one important point here, without going through each little checkbox, is this is not all about buildings and energy. It's not all about your facilities engineer. You need leadership across your hospital system involved in these initiatives. Next slide. Choosing wisely, I think, is an international phenomena, which started about 10 years ago, teaching clinicians, physicians to use tests more wisely and not order so many tests. And what they didn't realize at the time, because this wasn't about sustainability, is every test has a carbon footprint, whether it's an X-ray, CT scan, or simple blood work. So when you are a choosing wisely physician or a facility, you are decreasing your carbon footprint. As part of education, we wrote an article 6 months ago, which was published. We call it our low-hanging fruit tree. You can take a look at that. Next slide. Similar concept to the check boxes, but this includes a monetary logarithmic scale on the left. The full article shows 3 different colors of fruit. These orange ones we call the game changers. For a 200-bed hospital over a 1-year period, each of these initiatives listed on the tree would save over 100 tons of CO2. We also have yellow fruits, which are in the 50 to 100-ton range, and green fruits, which are 0 to 50 range. Clearly, they're all important. But partly what we're showing here, if you don't mind the pun, is comparing apples to oranges, in that I think that when people want to go after or or become more sustainable, the first things they think of are things like recycling or EV chargers for their vehicles, but those things do not make the game changer list. They are lower on the tree. So you can take a quick look here, see some of the most expensive ones are the ones that are related to the facilities, people building a whole new building, hundreds of millions of dollars. Upgrading your boiler is quite expensive as well in a big facility. An energy manager in Canada would be about $100,000 a year, but would pay their salary many times over through their initiatives. And then some of the neutral things like decarbonizing your investments. Most hospitals have a foundation. Are you invested in fossil fuels or not? Green procurement I'll talk about. Plant-rich diet or moving along that scale from meats to plant-rich is important. And arguably the most important one of all is deprescribing, because it's a game changer in terms of the color of fruit, and it's the lowest one on the tree. It saves $200,000 to $300,000 per year if you can decrease the number of meds you're prescribing by 5%. Next slide. This is from the Lancet from 2 years ago, very well-known graphic here. I love this one. A couple of years ago, this blew my mind. What it shows is that this is the carbon footprint of the healthcare system in the UK, which would include ambulances, dental offices, primary care, hospitals, everything all blended in together here. The green section shows transportation for visitors, staff, patients. Only about 10% of the pie, which is a surprise to me. The red section is essentially what's going on inside the building. And at 8 o'clock is building energy. Again, 10% of the pie. Clearly, a lot of engineering has gone into decreasing building energy over the years, and that has been successful. That wedge of the pie was probably much bigger before. It's not so big now. So what do we need to go after? We need to go after the supply chains. In this case, I think about 65% of the pie. There's a study done in Quebec in Canada, which just recently came out, which showed at a hospital in Laval, they estimate the supply chain to be 90% of the pie, just massive. So these are all the things that we consume, that we buy within healthcare, whether it's gowns, gloves, masks, office chairs, computers, MRI machines, everything moving through the building. Pharmacy is there, pharmaceuticals rather, from 12 o'clock to 3 o'clock. It's about 22% of the pie, just the production of meds. Next. So what can you do about the supply chain? So the supply chain loosely includes the 4 R's. Everyone's familiar with the 3 R's. We also include refuse, and we mean refuse the bad products. So you can use a gown, which is a throwaway gown, or you can use a washable gown. Some of the washable gowns can be washed 250 times before they need to be thrown out. The journey of a gown, we don't think about this. A gown is dug out of the ground somewhere in the world. Then it's transported to production. It's produced, and then it's transported to packaging, packaged, transported to the hospital. I wear it for 1 minute. I throw it out, and then it is sent to the dump. So that process, with all the millions and billions of things that we buy as societies in the world, is, that's what we talk about, the linear economy. We need to move to the circular economy in every way we can. How can we as healthcare professionals push this along? And the answer, we believe, is to push our system, our buyers, our procurement officers, to add sustainability weighting in the RFP proposal. So typically, Ontario, where we live, is buying 20 new MRI machines for hospitals in Ontario. Are they just looking at cost and quality? The answer right now is probably yes. But we've created a provincial green procurement working group, which has all the leaders of the big hospitals, which are the ones that obviously buy the most. And we are going to start sending language out to suppliers to say, part of the weighting will include how sustainable the product is. Next slide. This shows the journey of a computer. In this case, starting at, there's 2 pathways here, but we can start in the lower left in Chile, raw material supplier, shipped over to Southeast Asia. Number 2, shipped further north into Asia for module production, then shipped into China for final assembly. Number 4, then transported across to Mexico for packaging installation, then further north up into Canada. Number 6, that would be British Columbia, the consumer. All of our products are going through these kinds of supply chain voyages, if you will. Next slide. There are companies in the world, not-for-profits, that actually rate companies for how green or how sustainable they are. And these not-for-profits, and there's a few of them, have been doing this for 20 years. And I can't speak for other countries. I know in Canada, most people are not aware of these companies, and whether it's for a business or for your personal purchasing, you can cut through greenwashing and see who the best companies are. This one mentions 13,000 companies rated globally. It's now over 20,000 companies rated globally. And I stuck with the computer theme here. Next slide. And as you may know, at the last COP, although some people feel it wasn't terribly successful, one significant thing that did happen is that Joe Biden announced that the US government, which I understand is the biggest buyer in the world, is now going to look at companies through the same CDP website to see if they're reporting how sustainable they are. SBTI is science-based targets. It's another one they have listed there in the top right. So they will not buy from you unless you are transparent in listing your greenhouse gases. Next. Medications, meter dose inhalers, which we use for asthma, for example. 1 MDI is a 290-kilometer car ride, roughly. There are other types of inhalers which are not so damaging to the environment. Anesthetic gas is one of them commonly used, 2,200 times worse than CO2. This slide's 6 months old. It's now banned in 10 hospitals in Ontario, and this is kind of catching on in Canada. This gas is being banned, which is a good thing because there are other options. Prescribing less meds is kind of an obvious thing. We do overprescribe worldwide. There's reasons that that happens, and we need to be more careful about prescribing meds. Next. Building and energy. These are some of the usual suspects I've listed here, but on the bottom is one which, at least in Canada, is not happening as much as it should, and that is operating rooms require 20 cycles of air per hour for infection control reasons, as you can imagine. And most hospitals keep that 20 cycles going all night, even if the OR is closed. You might have a hospital with 8 operating rooms. You probably only need 1 or 2 emergency trauma units open. The other ones can be shutting down to 6 cycles of air an hour. Next. Food is huge worldwide. If you're familiar with Project Drawdown, which looks globally at solutions, not just within healthcare. If you have looked at that, the 2 biggest solutions in the next 30 years are plant-rich diets and decreasing food waste. So food is a huge one internationally. It's certainly something we can do better in our hospitals as well. In Canada, in terms of buying food locally, the food in Ontario travels 4,500 kilometers from field to plate, which is astounding because we buy a lot of our food from California. Next. This next slide shows the carbon footprint per serving of different types of food. I expect you've probably seen something like this before. Beef at the top, highest carbon footprint, and then moving down through dairy products down to the vegetables on the bottom left. Next slide. And the importance of transportation. So not only virtual medicine good in the office, if possible, but also good for decreasing flying to conferences. And so just like we're doing today, I didn't have to fly to Hong Kong or Australia to make this presentation. This is the difference between a North American staying at home on the right in green on their internet computer in their office. That is the carbon footprint, 10 kilograms CO2. versus flying to the conference in Europe. And you can see this the size of the flight in the big pink circle there. Next slide. So this is how Altaf and I met. I plant trees as part of a charity locally. I've been doing it for 12 years. We plant at hospitals, and we also take med students and physicians out to the country to plant and learn about nature. We've been doing this again for quite a while. That's Trees for Hamilton on the bottom. We just 6 months ago started a provincial group. So now we'll be planting trees all around the province. Next slide, with a goal of planting 1 tree for every healthcare worker. Someone at McMaster said to me, you should meet Altaf. He's doing all kinds of interesting things. So I went to one of his places where he studies carbon sinks of forests and looks at what the ideal forest is. For example, what mix of trees the ideal forest can create. And we were talking and thought, well, why don't we do this right in Hamilton? And a landowner gifted 1 hectare of land. And so now there's the McMaster Carbon Sink Forest. And if you're in Canada in the next couple of weeks, let us know. We're doing our planting in about 9 days. Next slide. This is an Australian study, which this is just showing why I talk so much about hospitals and not so much other things. Hospitals in Australia, public hospitals, private hospitals, 44% of the entire pie there. Next. Clinics. So if you're a family doctor, this is again from that same UK data. If you're a family doctor, this is incredible to me. Supply chain, once again, in blue, all the different parts of supply chain. Look at pharmaceuticals. 48% of the entire carbon footprint of the clinic is the production of the pharmaceuticals which we prescribe. Next slide. Every country is going to be different here. In Canada, we do happen to have a federal government right now, which is interested in climate change and is trying to make changes. We have a gas tax. We have banned certain types of plastic, but as you know, with governments, compromises always need to be made. And then on the provincial level in Canada right now, we have a government which is not so interested in climate issues and is making changes to previous governments which were beneficial, moving to more of a harmful approach. Next slide. So we all need to step up and take on climate action at our homes or offices, anchor institutions like hospitals. It's a massive problem. It requires a lot of leadership and a lot of climate action champions. Next slide. This is how you can reach me. I do consider it a hobby. I do this a lot and I'm quite passionate about it. Next slide. I am now also the executive director of the national organization, the Canadian Coalition for Green Healthcare. Has been around for 22 years, and we have a vision of not just the ideal green hospital, which you can still see under the H in the middle there, but how does healthcare sit in the entire community? How do you help create an ideal green community? And some of you may recognize that this is Oslo, one of the top rated sustainable cities in the world. And so our website will look essentially like this, and you'll click on these different things. You'll click on manufacturing in the top right. How can we work with big industry, government, universities? Agriculture needs to be more local in our case. So we're going to look at all these things. Next slide. I'm going to skip past this one because I'm running out of time. Finally, again, our organization is called Partnerships for Environmental Action. And I'm just thinking the Australians, if they just change the word partnership to body for environmental action by clinicians and communities, all you got to do is change the P to a B and you can have Beach Health Australia. I will finish on that note and welcome any questions.
Wonderful. Thank you so much, Dr. Sargeant and Dr. Arain. When we were first exploring this topic, I think many of us on the working group recognized we all had lots of learning to do in terms of what this could mean for health professions and health profession education. And I think you both have provided some very tangible, but also motivational reasons why this needs to be in a topic that we continue to address. We have some questions in the chat. The one right now is from Sharon, and or sorry, in the questions and answers, and it asks, what needs to be the key focus of what to teach students who are studying in a health profession regarding climate change? Both A, what do they need to know about caring for their patients, and B, how do they go about their practice?
I can start with that one. It's funny right now. So we have the guidebook for hospitals. We have a guidebook for long-term care. Right now, I'm on a deadline to produce a guidebook for offices for Monday. So we're thinking about this right now. And we have I have one of my colleagues who's a great educator looking at this exact question. What should we be teaching the students? I mean, certainly teaching them the awareness to begin with that climate change, as the World Health Organization would say, is not only the biggest challenge of the 21st century, it is the greatest opportunity of the 21st century. And so this, Charn, clearly, as you know, becomes very much a regional answer. So what I would be teaching my medical students about watching for the vector-borne diseases and how Lyme disease presents in Canada, and to be aware of those things. There are clearly other things that you would be teaching in. I'm guessing you're from Australia. So yeah, so clearly we need to know what the impacts are in our own regions. We all need to think about heat, and then all of us need to be just aware as teachers what. Actually, yeah, heat, and another one, of course, worldwide is climate grief, another thing to think about. So those are my thoughts, and then also from the administrative point of view, there's the entire adaptation resilience piece, and in terms of building our facilities of the future, we need to be thinking about that as well. Altaf, I don't know if you have anything on that one.
I think that you covered it nicely, but I would say that the biggest problem with the climate aspect is the public don't know. Like, we heard it all the time on the radio and TV, but a population would not know, including professionals, that what is happening and what's going on. And so I think this is a basic awareness that this is caused by the greenhouse gases. So it's not just the greenhouse gases, it's the consumption of the resources that's at the heart of it. So as a citizens, if this information is there, knowledgeable, so it will help in the professions, but it will also help in the life, in the decision making and the living. So I think the basic education is pretty nice. And then we have published papers, but in the end, we started the climate center here as well, just to inform the people, like what is going on, what the solutions are, and how they can contribute. And I think this movement is now, this kind of awareness is now very rapidly happening all over. So that I would say.
You know, I don't mean to put someone on the spot here, but Charn from Australia, I picture Australia actually being ahead of Canada in this domain. So you might not need a Beach Health Australia. I have a feeling you probably already have infrastructure working on this kind of thing.
Dr. Sargeant, I'm not entirely certain, and that's why I feel when we started down this path, we realised how naive we were. As I'm the Director of Teaching, Learning and Nursing at the University of Melbourne, and I couldn't say clearly how well or what we teach our students in relation to climate change, both for what that's going to mean for their care for patients, or what they need to be thinking in terms of waste reduction and all the rest. And I don't think we have some interprofessional activities that really bring that together either. So I think for me, this was a big gap. I'm not sure many of my colleagues would feel knowledgeable about what we should be teaching, let alone what we should be doing. And so that's why this has been so incredibly sobering but valuable, to be able to go, here's a whole bunch of resources that can shape what we teach the next generation and they can go forward with, and share with our industry partners as well, so that they're aware that we're focusing on it.
Yeah, exactly.
I can comment that we have the same is at McMaster. So I have received the request from the health sciences that how we can help in the curriculum. So I think the inclusion of some course, like making students one optional course on the basics of the climate, and normally in most universities there are always environmental departments, and there are always the courses. If they can take this one kind of course, that what the basics are and how it's changing, that will help, because everything is related to the health. So you saw in when Myles was describing the heat impacts, the flooding, so all has the health impact. So if you know the reason why it's happening and what are the thresholds, so it can be more specific to the medical as well. Like there are heat guidelines when the alerts will come. So the Myles had mentioned to me once that he was checking some older patients, and then he was prescribing the medicine, but then he was worried about that patient will go home, but he would not have air conditioning at his home. And then he was saying to me, my medicine will help, but more help is from the air conditioning. So if the doctors are aware on this kind of scenario, then they can make a better decision, not only for the medicine, but also the recommendation for the health care of the person. So the one good example is when we were planting the trees, we invited Dr. Myles said, okay, there will be medical students coming and planting the trees. So it's like an interaction there. So these are examples, but the way to go is the curriculum, maybe having one course on this kind of course that can be modified more towards the health, that will serve the purpose, or that will at least provide the basic information.
Yeah, Charan, I can't speak about nursing, for example, but on the medicine side, there aren't too many medical schools in Canada. Gosh, I want to say there's about 20 medical schools in all of Canada, and there's a table that the students have made themselves, the medical students, with sort of check boxes to say, do you have lectures on climate change? Do you have experiential learning? And so this is actually coming a lot from the students themselves, saying we need more curriculum on climate and sustainability. And sadly, McMaster does have a medical school, and we are behind some of the others on this front, but the students are pushing for this type of curriculum.
We have one last question. Oh, sorry. Go ahead, Dr.
Myles,
yes.
Yeah, Myles has Myles can answer this supply chain question.
Oh, sorry, I didn't see it. What is the supply chain question?
The question says, thinking about the supply chain of the healthcare practice.
Yeah, right. Yeah.
How do you see there are ways that we can transition to more sustainable supply chains, and where do we start?
No, well, I always joke, I'm not the smartest person in the world. I'm an Energizer bunny. So I get an idea and I just keep going after it. And when I saw that graph, that pie graph, that it was all about the supply chain, I started reading about the supply chain and what could I do about the supply chain. And then again, I started reaching out to the procurement leads. Now, of course, I had the position of being the lead of Peach at the time. So I guess it's nice to have a title when you're emailing somebody. And I would meet with the procurement leads and tell them, do you realize you hold the keys to the kingdom when it comes to sustainability? And of course, someone who went into procurement 20 years ago because they were interested in business, and it seems like quite an interesting field, and then has suffered through COVID, where the supply chain was so difficult finding products. And now you have someone like me coming along and saying, you are so important when it comes to sustainability. Like all of human nature, some said, oh, well, thanks for letting me know, I'm too busy. But others stepped up, and others were just really interested. And so that's the group that we have. And so collectively that group has grown and grown, and now actually our provincial leads come to that group as well. And we are going to be adding a percentage to those contracts, which will be about sustainability. And I do know that this is happening worldwide.
Yeah,
And
I would just make,
yeah, sorry, go ahead, Altaf.
I would make one more comment, because the COVID also taught us a lesson that the masks don't have to come from thousands of kilometers away. So many things can be manufactured local, so their carbon footprint would be much less, but they will also be distributed. Like we have learned many lessons. So if that lessons from the COVID we had to learn, so that was the lesson, like medicine, a simple thing like mask. So many things can be local as well.
Well, thank you both so much for spending the last hour with us. From the sense of the questions, I think we could keep you for another hour and continue the conversation, but we're really thankful both to you, Dr. Sargeant and Dr. Arain, for coming and starting the conversation with this group. And I think there'll be lots of wheels turning. In fact, I'm already thinking how, Dr. Sargeant, we can get the IPE group of students out planting trees in the next 9 days with the two of you here locally. So thank you both so much.
Yeah.
For those of you that are just wrapping up, we did want to mention that this is the first of 3 series. So we have 2 more sessions. The next one will be at the beginning of June, and that will be entitled Interprofessional Education for Sustainability, Pathways, Possibilities, and Experiments from Melbourne. And then our third one will be on June 20th at 1100 hours New Zealand time. So we'll make sure we share those as they come forwards. But thank you all for joining us from wherever you may have been. Good night, good day, whatever that might be for you. And thanks everyone for joining us.
Thank you very much.